We'll be live in 3, 2, 1, and we are live, doctor.
Good evening, everyone. Welcome to the first webinar of Career Genie, a collaborative effort by IDVL USL as well as IDVL Dermatology Education Task Force. And our first webinar is on why academic dermatology is increasingly relevant in changing times. I invite our President, Manjuna Chenoy sir, to address the audience.
Yeah, thank you, Dr. Namita. Thank you, Dr. Deepika and Dr. Deepankar, Dr. Namita, and everyone involved in today's very interesting topic, which is it's a joint venture from the USL as well as IDVL Dermatology Education Task Force. This is a very interesting title to why academic dermatology is increasingly relevant in the changing time, which means probably it was not relevant for a while. That question is existing now. I always believed academic dermatology is always relevant because what we have been taught is to acquire knowledge, which means science comes first. Then we acquire the skill, that is arts comes next. And finally, we think about commerce. So that's how we have been working as a qualified dermatologist. That's why it's very much relevant. It's always been relevant. But it's very interesting today because in given 1.5 hours, we'll be learning a lot of things, why academic aspect has to be focused much more than earlier, because now that we have so many other different issues have come, because the dermatology is one of the hot selling top subject. That's why a lot of things have come. So I'm not going to talk much more on this. Namaste, IDVL, and thank you so much for inviting me. I congratulate once again both the committees of IDVL. Thank you.
Thank you very much, sir. As always, being witty as well as a profound statement. I invite our Honorary General Secretary, Bhumesh Kumar, sir, to present Secretary's remarks.
Yeah, Namaste, IDVL. So on behalf of EC, I invite the faculty of this webinar on career gene. We know that IIDVL is committed for members friendly, committed for society friendly, as well as committed for the subject friendly. So as a part of the subject friendly, so this is a webinar which has been conducted by the USL as well as Dermatological Education Course. The chair and conveners of this, we welcome you. And we know that we have two lives. One is a family life, another one is a professional life. So where the academy, the knowledge update is very important. Unless we update, we will be outdated. So if you want to be young, always update your knowledge. So the IIDVL is providing the platforms to update our knowledge through academy, through webinars, through publications, through journals. So always the IIDVL is committed to update our members and keep the IIDVL is a young IIDVL branch. So anyhow, hearty congratulations to all of us. So let us learn something related to this practice and the institutions, all those things. We have eminent experts in this. Even I am going to learn many things with this. Thank you very much, Dr. Namita, Dr. Deepika Pandey, and Dr. Deepankar, and all the team, so for providing all this platform. So thank you very much. Over to Dr. Namita.
Thank you very much, sir, for always encouraging all our initiatives. Just 2 lines about Career Genie. Most young dermatologists, especially if you're like a first-generation doctor like me, you go through a lot of confusion after graduation. Which path to take? So whether to join a medical college or enter a corporate hospital or join a clinic chain or work under a senior. So we are very thankful, USL is very thankful to Dermatology Education Task Force as well as to the Practice Management Cell for collaborating with us for a series of webinars on all the above topics. So we'll be having subsequent webinars every alternate Wednesday at 8:30 p.m. I request Dr. Deepankar Desai, convener of the Dermatology Education Task Force, to present the outline of today's program. Welcome, sir.
Right. So thank you, Dr. Namita, and good evening, everyone. And on behalf of IDVL Dermatology Education Task Force, IDVL EC, and also IDVL USL, we welcome you all to this academic program, and thanks IDVL USL for involving the IDVL Dermatology Educational Task Force in the first of a series of activities, and this one is related to academic dermatology. And if we look into the definition of academic in, say, for example, in Webster or in Oxford dictionaries, it says that those who are involved or attached to an university and are involved in teaching and research. And if you look into the panel of the speakers or panelists that we have today, we have academics of all hue, both young and seasoned. We have aspiring academicians like Dr. Hitesh Mehta, who is a senior research fellow in the Department of Dermatology at PGI Chandigarh. At the same time, we have seasoned academicians like Dr. Marfatia sir, Dr. Manjunath sir, Dr. Deepika Pandey ma'am, Dr. Umesh, and everyone in the panel are somehow related to academics. And there are solo academic dermatologists, meaning by they are entirely into academic dermatology, and there are experts who are also in practicing dermatology. We all know that the government of India has an aim of opening one government medical college in each of the districts, and obviously there are private medical colleges. So there is enormous scope of recruitment of teachers in dermatology in these medical colleges. We understand that 3 years of training of dermatology in the colleges is foundation for future patient care and possibly foundation for teaching and research those who want to be in academics. And strong foundation in these 3 years can only be achieved with good teachers and good infrastructure. So infrastructure is out of our bounds, but then good teachers, obviously we expect that the young dermatologists, young IDV lights, they take up teaching. And this is why academic dermatology is increasingly relevant in the changing times. Dr. Manjunath sir rightly told that academic dermatology has been relevant, and it will remain relevant, possibly increasingly in the near future. Obviously, there are opportunities and there are challenges in academic dermatology, and we hope that we'll discuss all these aspects threadbare. And Dr. Namita has brought out a series of issues that are to be discussed in the panel discussion. But before that, there are 3 talks. The first one will be by Dr. Hiteshi. I just introduced Dr. Hiteshi a little while ago. Again, she is a brilliant young dermatologist, and she is a senior research fellow, and she aspires to be in academic dermatology. She's already in academic dermatology unofficially, but then she requires the official stamp of being an academic dermatologist. So she will speak on why I aspire to be in academic dermatology. This will be followed by a talk by Dr. Vishal Gaurav, who is a young faculty assistant professor in Maulana Azad Medical College at Delhi. And he will speak on why I chose academic dermatology. Dr. Bhavani Singh is a member of our IDVL Dermatology Education Task Force. He is an academic dermatologist, but then he also is involved in private practice. So he will speak on balancing between academic dermatology and private practice. There will be a panel discussion subsequently, and the panelists include Dr. Marfatia sir, Dr. Deepika ma'am, Dr. Manjunath sir, Dr. Bhumesh, Dr. Savita. Dr. Savita is based at Bangalore, and she doesn't require any introduction. And also Dr. Anuradha Bishnoi. She is again an assistant professor in the Department of Dermatology at PGA, but she has kindly joined today from USA. So she is on a fellowship in to USA for 1 year. But Anuradha, thank you very much for joining in an unusual time. You say that it's early morning there, and it's a working time there. So first, I will invite Dr. Hitaisi to speak on why she thinks or why she aspires to be in academic dermatology.
Good evening, everyone. I am Dr. Hiteshi. I'm a senior research fellow from the Department of Dermatology at PGI Chandigarh. And today I'll be talking to you about why I aspire to be in academic dermatology. So, at the outset, I would like to share a disclaimer that whatever I'm going to say are my personal opinions, which are based on my experience at a single academic institution where I have been from the last 7 years. And the preferences may vary from individual to individual. What I might perceive as a challenge, other might actually enjoy. So all opinions are to be respected. So starting with what I like about academic dermatology. So I see academic dermatology as a blend of clinical care, research, and teaching. So I'll be touching upon each of these aspects one by one. So starting with clinical cases. So I would like to share an interesting case that we saw in PGI a while ago. So this 32-year-old male, he came to us with a history of headache. He actually presented to a neurologist with a history of headache and lancinating pain over the left side of his face. So on his MRI, they found a space-occupying lesion around his trigeminal nerve. So they diagnosed him with a benign neurogenic tumor of trigeminal nerve, and they were planning a gamma knife surgery. So because he had some redness, they decided to refer to us in dermatology. So as soon as this patient walked in, we immediately thought of BT Hansen in reaction. So we did a slit skin smear, we did histopathology, and we were fortunately able to prove the diagnosis of BT Hansen in reaction. So with this diagnosis in mind, there was a new perspective to his tumor. So we were of the opinion, since we see a lot of unusual cases, so we were of the opinion that leprosy can rarely involve CNS. So this could just be neuritis secondary to the reaction rather than being a space-occupying tumor per se. So we collaborated with our radiologist and neurologist colleagues, and ultimately it was decided that we will just treat this patient for leprosy and reaction first, and then we will see further. So sure enough, within a few weeks of MDT and steroids, his lesion was completely gone. The so-called tumor had disappeared, and just because we had access to the expertise, we had access to the knowledge, and we had access to resources and the multidisciplinary care, we were able to effectively manage this case and avoid a procedure like gamma knife surgery. So this thrill of managing complex cases, so this is something you get in an academic setup much more than you would get in a private practice. So you have access to extensive resources, and if you want to do a multidisciplinary collaboration, so that is possible much easily in a medical college. So that this is one of the reasons why I would like to be in academic dermatology. You get to see such cases. And then another important aspect is research opportunities. So you get to engage in various research projects. You have access to grants and funding. If you want to do an interdisciplinary project, so that is an option. And ultimately, the idea is to be able to publish your results in a high impact factor journal so that they reach a wide audience and they're able to inform clinical practices and improve patient care. So this is something I have been fortunate enough to be part of during my time at PGI. So I have been part of various research projects. We have published a number of papers. So this is one aspect of academic dermatology that I really enjoy. Another is teaching and mentorship. So you get to inspire and educate medical students and residents when you are in academic dermatology. You get to guide the next generation of dermatologists. And I feel this is something which can be quite fulfilling. So in my time at PGI, I was fortunate enough to have access to amazing mentors who are well recognized not only nationally but also internationally. So they serve as a source of inspiration to me. So they're one of the main reasons why I aspire to be in academic dermatology, because I want to follow in their footsteps. Another thing is depth versus breadth in dermatology. So academic dermatology is more about the depth. So if you have a niche topic which you want to explore, if you want to develop a specific area of expertise, so that becomes much more easier in an academic setup compared to private practice, where it is more about the breadth. You have to manage a wide range of conditions. So there is limited scope of specialization. And then again, in an academic setup, you are continuously learning. There are ongoing classes, so you are updated in the recent advancements in dermatology. So you get to be part of various CMEs. So there is more scope of professional growth. So you get to take part in conferences and workshop more often, where you can present your own finding and get feedback on them. you get networking opportunities, you get to know what other people are doing, so you get inspiration. And overall, I feel this is something that drives innovation forward. So over the past few years, I've had the fortune of presenting my work at various national and international conferences. So this is another part of academic dermatology that I enjoy. So then we come to the work-life balance. So I feel working hours, they tend to be lesser in an academic setup. So you get more personal times, you have more time for your family and hobbies. And finally, you are part of an established practice. So you don't have to worry about setting things up. You don't have to take on too many administrative responsibilities immediately. You don't have to worry about gaining Instagram followers. So that's one part which I like about academic practice. And there's a support system with you. If you have a confusion, there's a senior or a colleague in the next room who can help you out. So this camaraderie is much more in an academic setup. So very briefly about what drives me away from private practice. So first is that there are high operating expenses. You have to arrange the equipment, you have to arrange the staff and office space, and then there's a lot of competition, especially even if you're working in a big metro to establish your practice, and you're under constant pressure to develop results and deliver them quick. So that can be a source of stress. And ultimately, in order to have a successful private practice, you need to be business savvy. So it's ultimately about recognizing your own strengths and weaknesses. So that being said, I do realize that academic dermatology is not without its own set of challenges. So you have publication pressure. There are administrative responsibilities. There's a lot of paperwork. You're part of committees, so you have to take care of that. I did say that you have access to research grants, but obtaining them is not always easy. And even in academic dermatology, there is competition for promotion and leadership positions. So sometimes it can become very difficult to manage your research patients and also your clinical care, because you have limited time in the OPD, and within that time you have to manage everything. So that can again become stressful. There is lack of autonomy because you cannot just do whatever you want. You have to take institutional policies and departmental guidelines into account. So you're not your own boss. So that's a challenge. And again, in academic dermatologies, the salaries, they tend to be lower compared to private counterparts. But I think this is largely balanced by the additional benefits that you get, particularly if you're working in a government setup. So finally, the challenge that I am struggling with right now, that is the lack of opportunities. So academic positions, they are highly competitive and limited. I completed my senior residency a year ago, but I am not able to find a position in the institution and in the cities that I would prefer. So being in academic dermatology, staying in academic dermatology is something that requires patience, and you need to have some sort of flexibility in your career planning. So to conclude, I would like to say that academic dermatology has its own perks and has its own challenges. So the things I said, they might not be applicable to every situation, because there are private practitioners who are doing research and publication side by side. And also there are dermatologists who are working in private colleges. So the perks I mentioned may not be applicable to them. So each situation has its own set of challenges. But what drives me towards an academic career is my passion for clinical excellence research and teaching. So I would like to thank Dr. Dipankar, IIDBL Dermatology Education Task Force, and IIDBL Yuva Academy for giving me this opportunity and for sending me down this introspective journey regarding my own career choices. And thank you.
Thank you, Hitashi, for giving us a young outlook of academic dermatology, and it was quite succinct that way that you highlighted both the merits and demerits of academic dermatology. So thank you very much. And next, I will invite Dr. Vishal, who is already an assistant professor. So he is already stamped as an academic dermatologist. So he will tell us about why did he chose academic dermatology. So over to Dr. Vishal.
So am I audible?
Yes, yes, you are audible. Yes.
So Good evening, everyone. At the outset, I would like to thank Dr. Deepika Panthi ma'am and the task force for giving me this opportunity. I'm working currently as assistant professor in Department of Dermatology at Maulana Azad Medical College. So, yes. And I would be speaking on why I chose academic dermatology. So as already discussed, that academic dermatology encompasses clinical care, research, and education, usually within a university setting as well as a teaching hospital. My choice of academic dermatology was deeply influenced by my mentors. The admiration for their dedication and the impact which they had on me was truly marvelous. So it was for my choice was deeply influenced by my mentors. Thereon, I looked at the other aspects of which I will be talking subsequently. So first, you get to touch a life, I think personally, much in a much greater way when you are attached to a teaching hospital or when you are attached to a tertiary care center, because it leads to it in two ways interaction. First, it helps the patients in a major way because they're usually able to get a multimodal approach to treatment, as well as we get to educate ourselves with the multiple ramifications of the same disease. Cross referrals are much more easier. That leads to us gaining much more knowledge with each case which we see. And at the end of the day, we also feel satisfied that we were able to help some poor patients, usually because patients coming to our setup are usually poor, those who cannot afford quality care. At the same time, when you are at Upringer Institute, you also have access to many treatment modalities which might not be easily accessible to other dermatologists at the same time, especially those who are engaged in PP, as these equipments can usually be very costly, or they may require specialists from other departments. For example, Mohs surgery, or for example, having a rigorous dermatopathology setting in your setting. As I already discussed, this multi as was elaborated by Hitaishi by showing us a case. Similarly, we also saw a similar case where there was a trophic ulcer in a mycetoma. And when we examined thoroughly, it was actually the patient had been operated for spinal dysraphism. So I was initially perplexed, why is it there? And then when we got a proper neurology testing done, we got to know that there was sensory loss, and that was leading to that trophic ulcer. So, and again, we keep on learning so much when we have other departments which can refer patients to us. For example, the side effects of chemotherapy. Usually, we don't get to see them when we are practicing alone. And another aspect is the teamwork, not only with your residents, but also with other departments. You have to continuously engage with other faculty for cross referrals, for seeking their opinion, as well as you are interacting with the HOD, with other people in your department. And this somehow develops a team spirit. Not only this helps you when you are caught up in a difficult situation, when you are not able to make a diagnosis, you always have people at hand whom you can ask for opinion, you can take their opinion and decide on it later. Another aspect is the community aspect of dermatology, which we are able to practice as being affiliated to medical colleges as well as through national programs. We get to touch millions of lives by participating in these programs. The importance of research cannot be overemphasized. We all know that we need research to continuously keep progressing our field of dermatology and to grow the body of knowledge which dermatology has. Research is much more easier when you are in an academic setting versus a private setting. It develops new treatment guidelines. It can help improve patient outcomes. It can challenge old existing theories, which may not be applicable today. But all this can happen only if we have robust research. Same is true for translational research. Again, doing preclinical studies or clinical trials is quite difficult when you are in a private setup, which is much more easier in an academic setup. You can also have future directions for the field of dermatology by engaging people who are there in other countries for facilities which are not available in India. All these collaborations are much more easier. For example, when we were trying to decipher the pandemic of chronic dermatophytosis in India, we took help from our German friends, and that's how we got to know about this new species, which was instrumental in our understanding of dermatophytosis in depth. Similarly, many tertiary care hospitals in India, they do have the facility of teledermatology as well as digital health. All these things become very, very complex when we are outside a tertiary care center. And the part which I love the most, that is teaching medical students, the residents and the fellows. Uh, I think teaching is one profession which is as noble as it can get. You get to touch the life of so many dermatologists as a professor. All the residents, all the senior residents who come and join your department, you do leave a mark, as I remember all my faculty members, and they have left an indelible mark on my career as well as my mind. And I do admire them a lot for their contribution. So yeah, so there is, I don't think that it is possible for you to touch someone's life so personally in any other profession except for the being a medical faculty. Not only that, you get to decide what your residents need to learn, you contribute to curriculum development, and you also ensure a high quality standard for clinical education. For example, I recently participated in an undergraduate development curriculum development program where the focus was on CBME, competency based medical education. And we all were planning that how there should be a simulation lab where we can teach them basic dermatosurgical skills as well as bedside tests. So these mentorship programs, they form the cornerstone of academic dermatology by providing our young trainees, by helping them navigate their career path as well as in their professional development. Another aspect is getting to engage and organize so many workshops and conferences, which not only helps in exchange of knowledge, but also leads to professional growth. It also leads to many opportunities where we can present our research, we can network with our peers, and we can learn about the latest developments in the field. So, and they enrich our career, they offer opportunities for leadership roles, they give us recognition, and it also leads to contributions to the field's achievement. Work-life balance is much more predictable in a scheduled manner. There is flexibility, and you can which actually supports personal well-being and career satisfaction. This I already discussed. So coming about income, we all agree that it is not too much, but it is not too less as well. And academic dermatology usually is in a government setup, so that leads to a stable income with job security as well as the benefits which the government provides. This leads to a balanced and secure financial situation. Again, there is stability and which comes with government employment, and there are opportunities for extensive research, but yeah, it can be difficult at times to get them. So what are the disadvantages? One is the high workload. So balancing clinical research teaching duty can be challenging at times. Then there could be additional administrative burden, which could be monotonous at times. For example, managing grants, publications, the departmental responsibilities in particular. There is a constant pressure to publish. When you look at your peers, so you want to publish as soon as possible. That can lead sometimes to stress and anxiety. Again, as I already discussed, there could be funding challenges, and the economic growth is slightly lower. Having said that, I would like to say that consider a career in academic dermatology to make a meaningful impact in patient care, research, and education, because your contributions can shape the future of dermatology. Thank you.
Thank you, Dr. Vishal. It was fantastic, and then I can understand the passion in you of teaching postgraduates, the fellows, and also mentoring the young colleagues in your department. And obviously, in those faculty in the government hospitals, they are much more better placed in helping out poor patients that way. So thank you very much. It was a very nice talk, Dr. Vishal. Now I invite Dr. Bhavani Singh, who is a professor in the Department of Dermatology at IMS and ACUM, Bhubaneswar. So Dr. Bhavani has been in IDBL Academy in 2020 and 21, and then he is a member of IDBL Dermatology Education Task Force. He speaks very less, but then the work output from Dr. Bhavani Singh has been quite enormous, and I mean, whatever he does very meticulously, and I'm sure he will enlighten us today about how he balances between his academic dermatology and practicing dermatology as a career. So, Dr. Bhavan, please.
Thank you, sir. Is my voice audible, sir?
Yes, it's clear.
Does the screen change? So I have to stop share. I have to share again. Sorry for the technical delay. I hope my screen is visible.
Yes, Dr. Bhavan, yes.
Yes. So very good evening to all the dignitaries and delegates. My credentials arise from the fact that I happen to work in a medical college, and at the same time I do my private practice as well. Before me, all the two of my brilliant young speakers have spoken very high of academic dermatology. I am not in a position to debate between academic dermatology or a private practice. So my job is to speak how to balance. If at all you're doing a private practice, being an academician, how to balance them. In fact, I would rather feel it would be integrating between the academic dermatology and private practice rather than balancing. So they are complementary, they are not disjoint sets. So we'll discuss, for the sake of convenience, we'll discuss two subclasses of doctors. One is a private practitioner pursuing academic dermatology, or it's a pure academician who runs a personal clinic. So there are three basic rules. These are all my personal opinions. There are no definite guidelines. And if at all there were guidelines are not gospels. So it is all individual discretion, how to manage their own lives and professional academic life and private practice. So we have to set our priorities very right. We have to define realistic and achievable goals. And the most important thing is we have to schedule our time so that we can manage both the aspects of dermatology. Let's discuss about private practitioners who want to pursue academics in their life. So what is academic dermatology meant to a private practitioner? It could be simply reading books, staying updated for the sake of personal satisfaction. But to me, I feel the best thing which relates academic dermatology to a private practitioner is to practice evidence-based medicine. Or it could be academics in the form of delivering talks, attending conferences, pursuing research, or publishing your work. So what are the issues that happen to come across if it's you are in a private practice? So you have to, first of all, you feel that there is a problem with time management. You feel there is a lack of resource, and most importantly, there is a lack of motivation. So how to deal with these points? Basically, we attend conferences to update our knowledge and to grow in our academic pursuits. But I feel you should not attend all the conferences. Please attend conferences or CME or workshop need based. For a private practitioner, if he does, it will definitely add value to his academic knowledge. And please do read what you find difficult in your practice. Instead of, you do not have time to go through everything, so whatever you find difficult in your practice, day-to-day practice, please go through the same topics. And we know, as far as resources are considered, we have peer group discussion like acad, WhatsApp groups, IDVL Academy website. So you can discuss with your colleagues. Even if you're in a private practice, you do not seem to being alone, so you have a scope to discuss with your groups. These days it is possible. And how to publish? If you're in a private practice, then still it is possible. We have so great examples of private practitioners who are great at publishing. So in the initial days of practice, try to focus on case letters, clinical images, or to be more convenient is you happen to see side effect of drugs. These are certain areas I feel a private practice can focus to publish in his initial days. So what are my suggested solutions? We should all private practitioners should start archiving. They should maintain a digital record, or a clinic management system should be hired. It is better to read review articles and recent guidelines instead of going back to the voluminous textbooks. And as already my previous speakers have said, try to find a mentor for yourself. And certain small tips and tricks, I would say, we tend to forget keeping photographs. Please keep a green screen in your clinic and try to take photographs of each and every patient. You never know what diagnosis might pop up ever, and you happen to lose the photograph. So please keep a separate digital camera or a cell phone camera. These are small tips and tricks which I have nurtured and understood during my years of practice. So that you do not tend to lose them, and you can archive them, and they will be useful for your academic pursuits or publications. See, this was one of the beautiful example which has inspired our generation most. So innovations do not always require resources. You need not be in a medical college or in a very teaching institute to publish. So you can pick up small things in your day-to-day practice and publish them. This is one of the publication, my own publication, which we found. It's a simple thing which you have seen in your clinic also. You can do, and you can publish it. And for a private practitioner, always to be in touch with the databases. Sometimes they are free or paid. You can subscribe to various databases like Medscape, UpToDate, and therefrom you have a good voluminous resource of academic knowledge. Please keep a set of close allied specialist friends, starting from a pathologist to a microbiologist, or for that matter, neurologist, as you get in a medical college or teaching hospital. There are many private practitioners belonging to a DM and MCH subjects. Keep in touch with them. This will help you grow. And also, being a private practitioner also, still you can pursue research. Various ICMR projects are there, IDVL grants are there, and you can also get a ethical committee clearance from a nearby medical college. So these are not impossible for a private practitioner. Still, if somebody is very much interested, there are scope and you can do it. So we happen to be a part of IJPGD. So this is a very nice publication. There are many online resources for dermatology residents or young private practitioners. You can go through them. There is a voluminous amount of resource for available free. This is my personal opinion. I believe every private clinic or every private practitioner must keep these two books handy with him or her for practicing evidence-based medicine. Let's now discuss how academicians will cope up with private practice. How do they integrate or how do they balance? So, what's practicing dermatology? Practicing dermatology is either clinical dermatology, lasers, aesthetic, dermatosurgery, dermatopathology. But my personal opinion will be, in initial years, let us focus on only one aspect of these dermatology. Clinical dermatology is no doubt universal, but let us not branch out to and start having the idea that I'll do everything. This will definitely affect your personal and as well as your professional life. So what are the issues that bother a private practitioner, an academician who wants to pursue private practice? First is time constraint. When we work 8 hours in a medical college and we get some income, and we believe that working 2 hours in the clinic will fetch us that amount of money. So that never happens. So time constraint is there. You devote 8 hours to a medical college, but you devote 2 hours to your private clinic. Then we often jump into competing with our fellow colleagues who are into pure private practice. Please do not do that. You can never match up them because they give more amount of their time and energy to their private practice. So for academicians who want to pursue private practice, stop competing. Take out that feeling from your mind. So don't try to do everything by self. If you're running a clinic, hire staff. Many times academicians are overburdened with academics. That is also an issue that bothers them and don't have the urge to get established quickly. So these are my suggested solutions. When you are into a medical college, as already my previous speakers have said, you are into curriculum development, you have to devise guidelines. So you're into too much of academic task is also assigned to you. So you involve your junior colleagues to do that so that you can spend some time for your private practice. As I've already said, you have to hire a staff. Don't ever believe that you can do everything all by yourself. Please stick to time. Even if you're a medical college, you cannot have the excuse and you would reach late to your clinic. Patients don't like waiting.
Dr. Umesh.
So be available to your patient even if you are on an academic break. So whatever you learn in your academic curriculum or your medical college, please try to implement all these new things in your practice. In the initial days of practice, you'll be in a crunch of money. It is always advisable to run your own pharmacy. That will take a lot of your economic burden. That will ease out to you. And it is better to use technology. See, you have to have a clinic management system. You need to give a digital prescription that adds, and that also burdens you lesser than if you write or you do not use technology. At times, we're also in a state of academic fatigue. So I believe you have to learn politely to say no if at all you are being overburdened with academics. And this no is green. So you have to take it positively. But there are many things beyond academics and practice put together. We have to take care of our health, have our own leisure, spend time with family, and above all, intellectual and spiritual growth is also a must requirement for all, be it an academician or be it a private practice. So these were my personal suggestions, how to integrate. Instead of feeling how to balance, let us integrate. Let us take positive of one aspect of dermatology and implement and use it for in the other aspect of dermatology. So thank you all.
Right. So thank you, Dr. Bhavani. And so being in solo academic dermatology, it was quite refreshing to learn from you how to integrate academic dermatology with practicing dermatology. And I'm sure those who are in the audience will be benefited by your tips. I won't say tricks, but tips, and these are all derived from your own experiences. And I think that is a very important part of your presentation. So next, it's over to Dr. Namita for the panel discussion. And in the earlier part, I didn't acknowledge Dr. Soumya Sachdeva, who is the convener of the Yuva Cell. And once again, I thank Dr. Namita and the young colleagues in her committee for having involved the IDBL Dermatology Education Task Force in the first activity of career journey. So over to Dr.
Thank you very much, sir. So I've shared my screen. Is it visible, sir?
No, it's not visible. Yeah, it's visible.
Move on to the panel discussion. We had 3 brilliant talks in this session, and the panel discussion is about career progression in various categories of medical college. And with us, we have academic giants today. We have all of them have, forget double digit, most of them have triple digit publications, a lot of conference presentations and textbook chapters, and they're all well known for their academic prowess. So I will not get into the depth of their CV, but with us we have Manjunath Chennai sir, president of IIDVL, and sir is a professor and HOD of Department of Dermatology at Yenapoya Medical College. Welcome, sir. We have Bhumesh Kumar sir, who is the current Honorary General Secretary, and sir is Associate Professor and HOD of Dermatology at Gandhi Medical College and Hospital. Welcome you, sir. Dr. Deepika Pandey ma'am is currently the chairperson of the Dermatology Education Task Force. She's a director professor of at dermatology at University College, New Delhi. Head of Department of Dermatology at Delhi University. Welcome, ma'am. I also welcome Dr. Dipankar Desar. He's the professor at PGI Chandigarh and also the convener of Dermatology Education Task Force. And we also have Dr. Yogesh Marpatia sir, who's been the former IIDVL president and who is a professor of skin at SPKS Medical Institute and Research Center. It has also been a former professor at Baroda Medical College. Welcome you, sir. We have Savita ma'am with us. She is currently the professor at Saptagiri Institute of Medical Sciences, Bengaluru, and also a consultant dermatologist at Roots Institute of Skin Center. And we have Dr. Anuradha Bishnoi, who's currently in the United States and joined us. She's the assistant professor at PGI Chandigarh. I welcome all the panelists. So first question is that what drew you towards a medical college career and why did you opt for a career in medical college? I request Yogesh Marpatia sir to start for this question, and then I invite all the panelists to answer this question. Yogesh sir?
Yes. So actually, at the beginning of my career, after passing my MD, I had naturally kept both the options open. That is practicing, starting my full-fledged practice, and second is academic. At that time, before 40 years, academic was not valued much. Even my family member were not clear what this assistant professorship in medical college, which is in the one corner of city, mean. So, that was the dilemma, but eventually I got early opportunity. My professor retired and I got opportunity at early age. And right from the beginning, I have inclination for teaching and learning. So this inclination then facilitated my decision to join full-time or full-fledged career in medical college.
Thank you, sir. Manjunath sir?
Yeah, thank you, Dr. Namita. Why I opted, each person has a personal reason. So this is my personal reason. First thing is I belong to very small village, a very, very small village. After doing my MD, I thought of going back and starting dermatology. Actually, in such places where that concept of dermatology wasn't there, it was not easy for me to start my practice in such a place. At the same time, the opportunities came because in Karnataka, which is well known for a lot of medical colleges, during that period, a lot of colleges came up. So opportunity existed. So that is the reason why I joined. Well, I also had, as was spoken by some of very erudite speakers, that I was also impressed a lot by some of my teachers, mentors, who pursued their teaching as well as academic careers. And also many of the faculties whom I happen to meet them and interact with during conferences and all, that promoted me to take up a job in a medical college.
Thank you, sir. Bhumesh, sir?
Yeah. So thank you, Namita. So why I opted in my medical college is the passion. I have a passion to teach the students, UG students and the PG students. Not only that, the treatment, because the teaching profession, which is the source for to generate the next generation of the students. So of course, the practice is also important for the livelihood, but the best way to learn is teach. So that's why I have a passion to teach our students and to create the generation of next doctors.
Thank you, sir. Deepika, ma'am?
Basically, I mean, I always had clarity of thought. I had a role model in my house, so I saw the kind of life you get with being in academics. So I had that head start. And the most important thing was I enjoy the thrill of discussion, and it's like Sherlock Holmes. So I think dermatology is like Sherlock Holmes. So you see something and you reach a diagnosis. So that kind of thrill, it's only thrilling when you share it with somebody. If you're
Yes.
sitting alone in a clinic, the thrill, virtual interaction will take some time. So that instant thrill when you, as a group, figure out something and you discuss and the diagnosis comes, that thrill is something which is unmatched. So that was what made me realize that this is what I want to do. Private practice was not even an option I considered. So it was telescopic and I was lucky to get what I wanted, maybe. And the third thing is, I think, being honest. I don't know if my co-panelists would agree. I really enjoy my vacations. I need that break, and I cannot imagine how anybody can work 6.5 or 7 days a week. So maybe that's me. I love my summer vacations, my winter vacations. And I think that's mandatory. So several factors in addition to what everybody has already said.
Yes, ma'am. Deepankar, sir?
My wife is a practicing dermatologist, and I didn't want to compete with her. So that is in lighter vein. But then I like to answer to questions, right? So and also find out. I like teaching. I like interacting with young colleagues, the students that those who join our department, and I also like to find out answers to interesting research questions. So primarily, it's teaching and research. That's why I preferred academic dermatology over practicing dermatology. And both of these domains that actually require a different sort of skill sets. And I find that I am not a good fit for private practice. But then there are colleagues here, including Dr. Bhavani, who told that how to integrate and how easily private practice can be integrated into academic dermatology. So that's about me as an academician.
Thank you, sir. Savita, ma'am?
For me, being a first generation doctor, so I was inspired by my teachers. All of them had were in academics with private practice. So, and considering even at home, both my parents were government employees. They also said it's medical college, job stability, stable income. So they also were not for private practice. So it was always, my mom's a teacher. So when I said this option for medical college, she was like, yeah, this is the option. So this took over. The opportunity came just after I finished my post graduation, and I got into a medical college, and I started off from there.
Thank you, ma'am. Dr. Anuradha, the youngest in our panel.
Whether you are not audible.
Unmute. Yes.
Am I audible now?
Yes, yes.
Now.
Yes.
Sorry. Thank you so much for having me here. For me, when I joined as a resident at PGI Chandigarh, I had no idea about academic dermatology or uh, private practice, but whatever I learned was from my teachers, my faculty at PGI Chandigarh, and we had so much of didactic curriculum and excellent curriculum. And I think that coupled with the guidance of the faculty, and then just seeing the like very complex cases on a regular basis, so that is what probably so after I completed my junior residency, then I thought of to get a position at PGI Chandigarh. So for me, another aspect was that I sort of just wanted to continue at PGI Chandigarh. So my faculty is very important to me. They are all amazing people and amazing academicians. So that is what my reason was, because I had no prior experience or anything, and obviously research, as Dipankar sir told, that I think the main difference between the private practice and academic practice will be the research and teaching, because patient load, it varies depending upon the type of private practice we are talking about. So the complex medical dermatology cases ultimately come from all parts of India to medical colleges, so they are most of the time seen by private practice people. So it's not we definitely get a good load of cases, and then you can develop your own area and people know you by the disease, but it's mostly the research and teaching, and obviously your faculty and your seniors. So that was my reason. Thank you.
Thank you. Manjunath sir was my UG teacher, and I think he was one of the wittiest and the happiest people I ever came across. And that's the inspiration for me to be in. I thought, being in medical college and taking dermatology is the key to happiness, is what I thought, looking at him. And that's how I ended up in teaching career. So as
Namita
most
has
of you,
got a unique distinction of being a student of two
please, sir.
presidents, ideal
Please, sir,
presidents.
Venkatram sir too.
Yeah, three, honestly, yeah.
Ramesh Bhatt sir and Venkat sir, thank you, sir. So, as everyone, to summarize it, I think it's passion as well as the work-life balance to some extent. That's the reason why most of us are continuing in a medical college. Just a brief thing about the criteria for recruitment as well as for the promotion in a medical college. Will Sir Dipankar sir, could you just highlight about what is the criteria for recruitment in a central government medical college? Or?
No, so for us, it's primarily to look into one's aptitude as we have discussed earlier also, not in that order, but it's patient care, research, and teaching, right? So, I mean, there has to have experience in post MD teaching, that is 3 years of senior residency, or 3 years of registrarship, or 3 years of, say, for example, assistant professorship in an institute or college, where there is teaching facilities, meaning by where there are senior residents, or where there are dermatology residents, right? And research, I mean, how do we assess research capability in a young colleague who is aspiring to join our institute? So that actually is determined by the publications that the candidate has. So most important thing is the publication of one's thesis, because that is the only original article, or one of the few original articles that the candidate has. So that is important. So one thing is I mean, whether there is requisite experience of teaching or not, and whether there is aptitude of research or not. So that is for recruitment, and promotion somehow is time bound here. So for assistant professor to associate professor, it's 3 years, and then associate to additional 3 years. And from additional to professor is 4 years. So from assistant to professor is 10 years here. And it requires a certain number of publications in good impact factor journals. one, and then there has not, the career in the previous grade or previous grade of faculty position, it should be stain free that way. So that's what the primary requirement for the promotion to professorship.
Manjunath sir, in other institutions, what is the current promotion recruitment criteria as well as for promotion, sir?
Yeah, I think first recruitment criteria, I'll take it. Recruitment criteria is obviously, there should be a vacant post.
Yes.
That's the first thing. But then beyond that also, some of the institutions do take, for example, my institution, the requirement is 4 here. That is professor, associate, assistant, and SR. But we have 9 people in my institution. So each institution has a different, that is because mine is a deemed to be university. So generally, deemed to be universities appoint beyond the requirement because they think it's required for various other purposes, such as, we are also given certain administrative jobs also. Maybe, of course, that is also happens in government colleges also. Now, Marfati sir is here. He's been medical superintendent. He's been principal. He's been whatnot, everything. So, of course, in government institutions also it happens. But in deemed to be universities, it's like that. But otherwise, primarily the recruitment criteria is there should be a post, vacant post. Number two, for the promotion, there are 2 ways. Again, there should be a vacant post in most of the state-owned institutions and many of the private colleges. That is how it works. But in some of the institutions, especially in deemed to be universities, the promotions are also given time bound to an extent, that is until associate professor or an additional professor. Beyond that, again, there should be a post should appear. But then there is something called rotational HOD post. Since most of the institutions have single unit, dermatology is generally a single unit. Maybe there are few institutions which are more than 1 unit. Wherein, because after 3 years or 5 years, once the HOD post ends, that ends, then the person who is next, who could be associate professor or additional professor, is promoted as professor and he is made the HOD. That is because of the rotational HOD-ship, which exists in many of the institutions, especially in deemed to be universities. So otherwise, again, recruitment and promotion, if you ask me, one answer is having a vacant post is the only criteria otherwise.
Thank you, sir. Just to summarize the recruitment and the thing, for Central Institute, it's 3 years of teaching experience as SR after PG, then 3 years of AP for associate, 3 years of associate for additional, and then 4 years. Whereas for NMC bound,
it's a little different for some of the universities. So we
Okay.
have what is known as DACP, that is the Dynamic Assured Career Progression Scheme. And so that has fixed. So it is 2 years as assistant, after 3 years of senior residency, 4 years to professor, and then 7 years as director professor. And what we need to remember is now NMC. See, AIMS and PGI are the only institutions that are not under NMC.
Yes.
Just every institute is under NMC. And as per the NMC guidelines, you need 8 years to become a professor.
Yes.
So it is 1 year as senior resident, minimum of 4 years as assistant professor, and then 3 years from associate to professor. So this is one of the inherent benefits that within 8 years, you can become a professor.
Yes, ma'am.
So it is rapid progression.
Yes. This is the current criteria.
Yeah, even in government sector, it would be different. For example, if you take in Telangana, we have a 3-tier system. So where I was joined in the director of health, I worked in the PSC at the remote areas, the districts or talukas. Then we have a commissionerate where the area hospital, there I worked. Then they will give announcement, notification to absorb into the teaching hospitals. So initially, now latest is because of many medical colleges, they are recruiting directly by contract basis, but a regular basis, you have to join with the director of health and we have to work in the commissionerate, and with the notification, we have to observe. And the promotions are very, very difficult in government service. See, from me to become associate professor, it took 21 years. So again, from associate professors, the professor, when the bottleneck is assistant associate professor, because of limited medical colleges and the faculty. So the promotions, actually the career, the time-bound promotion they are supposed to give, but which is also not happening. So some difficulties in the teaching in hospitals, but if you have a passion to teach, so we have to adjust all those things. And of course, the promotion part, the career advancement, if they plan, so even after automatically in the central institutions, automatically by 4 years, 5 years, 8 years, they will promote it, but which is not happening in some institutions, like particularly the medical and health of the Telangana and AP.
So the
Thank you,
advice
sir.
is that you should be familiar before you sign up about exactly what is the, the usual practice of that state. So that is, I think, the diverse kind of experience and what is happening. So you should be familiar with the state you are in. So it cannot be uniform.
Yes,
Yeah,
ma'am.
it is
That's
not uniform. Actually, in most of state on western part, I know there is nothing like 3 years SRC. We can directly recruit assistant professor. Of course, after 1 year after completing MD, there is a directly, scope to enter as assistant professor. We don't have that 3 year residency criteria, SR criteria.
Thank you, sir. I think most colleges in Karnataka do follow the 3-year SRship, although it is adjusted as per the need.
You finish your chapter.
Deepika ma'am, so how to work towards attaining an academic position? And what are the requirements?
So I will begin with what you can do. The rest God will do, because as we saw that, it is very competitive because there's just too few, options available. And if you heard what most of the panelists said, like Savita also said, the opportunity was there, so it's a matter of your luck that it is available. Otherwise, there are people who have worked a lot. So I want to put that disclaimer right in the beginning. Because see, we have, I think, if I remember correctly, total 220 odd government and private colleges that are offering MD dermatology, and we have around 706. So even if like every institute is not as kind as Dr. Manjunath, so they will never recruit beyond the sanctioned post, especially in government institutes. They will in fact try and ensure that you have the least possible, even in some private colleges. That is maybe the deemed university, they are more liberal. Logically you have under around 700 or 800 teachers. That's the maximum. And since the retirement age is now 60, 65, mostly, so the opening that you will get is either in a new institution, like you had so many aims coming up. So the opportunity is kind of, a matter of luck. So what is required is, we've been talking about what are the recruitment criteria and what are the promotional criteria. So you need to work towards that right from the beginning. So like you now have, this is the current generation because of the lack of opportunities. Even in school now, people start working for a university admission, beyond studies, social work, and so many others. So similarly, you have to be clear if you're interested in academics, you have to publish, you have to have research, you have to, if possible, actively participate in research projects. So that shows your commitment. And if possible, even you can do so, there are even as senior residents, there are options of doing, teaching programs. So that are offered by almost every university now. So that shows your commitment. So all that will, send out a very positive message to the interview panel, because that shows your how much you are interested in the job and how you're working towards it. So you would need to start early. And even NMC now mandates that you should have some publication or presentations during your post-graduation. But it's like if you are doing consistent publishing, writing chapters, making presentations, so all that reflects in your CV and you will score over other people who appear for the interview. And of course, knowledge, there is no replacement of knowledge. So keeping updated, because it is there are going to be a lot of theoretical questions. So that you need to keep abreast of, with the latest developments in the field, and diverse, because that's what they'll be looking for.
Thank you, ma'am. Yogesh sir, any inputs for this?
See, we have most of the state, they have public service commission. So there you have to go. Now they take even written exam. Previously it was only interview based. But then, of course, their skill are being tested by experts, and here everything counts, right from publication to presentations, and I mean your knowledge. So here, at least most of the state, this is the position, except in private medical colleges where there is a recruitment through management. But most of the state and central government, we have something like public service commissions, and there it is a competition, and you have to compete right from your basic entry, then associate professor or professor. So promotion is both way. It is by selection or by seniority. So both type, depending upon the requirement, it is followed in our state.
So for central, we did not have any written tests. So it is, I think, again, you'll have to follow because it might be variable. And in Karnataka, as I know, it's quite different from other places.
Karnataka, it's only interview.
Yeah. So even for us, it was only interview. So there, you take at different levels. That's what I know about Karnataka. So the lack of uniformity is quite stark. That has come out even in this interview panel.
Yeah.
So everybody, if you're interested, you would need to know the local
Yes.
policies.
Yes.
And
It's pertaining to state.
yeah, also you should be prepared to take your transfers if you're in government circle, if you want your
Good point.
promotions. So that happens in state, sometimes many people like to continue as an assistant professor rather than taking promotion and going elsewhere. That's especially true in institutions where, even in government institutions where practice is allowed, because many of them would have established their practice. So they wouldn't like to take the promotion and they would like to continue in that position. But, that's how it is.
Just so that the young audience who are listening to this get to know what is the economic implication of the job. Just discuss in the salary that is offered. So, Dr. Anuradha, what is the salary that can be expected for each post in a central institute?
So in central institutes, I think it varies according to the place where.
Okay.
So Chandigarh, so I think Delhi offers the highest salaries, and
Okay.
then so it's around for me as an assistant professor, it was around 1.5 lakh per month to begin with, and this includes many types of allowances, including your research allowance that you have to sort of notify in the end of the fiscal year to say that, okay, that particular amount of money only for research. Also includes non-practice allowance, and also includes house rent. So including all those things, it's around 1.5, like which is comfortable, and as was discussed in the talks, not too much and not so. And then it's sort of by around.
You were not audible. You were not audible.
Am I audible now, sir?
Yes.
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 So around 1.5 lakh to begin with, and then I think per promotion it increases by 40 to 50,000. That I'm not very good at remember. This is Chandigarh.
That, Namita, is one of the criteria. So the money really doesn't matter, as you can see from Anuradha.
Yes.
She doesn't even know the final salary.
Yes.
Where she's heading, she has no idea.
But one thing I think it's important that if Anuradha gets 1.5 lakhs, then she gets a cut of 20% for income tax. So she gets only maybe 1.2 or 1.1 lakhs, because she can't show any expenses that way.
Yes.
So salary in government job, I mean, you need to consider that also. So almost 1/3 of the salary is mandatorily gone into income tax. So take home salary is X minus 0.2 or 0.3 according to the slab the person is in.
This was what the Central Institute, like aims, peripheral aims. This was what was told by the current SRs there, numbers given there. So I think in the other institutes, like private institutes, currently this is being offered, like around 80,000 to 1 lakh per SR, 1 to 1.4 for assistant, and 1.3 to around 1.7 for associate, and 1.7 to 2.5 for professors. This is, I think, a range for depending on the availability, depending on how badly a college needs to fill that position in private institutes. Any inputs for this?
Dr. Namita, I'd just like to say I was in fact, I'm sure Dr. Manjunath, after interacting and Dr. Bhumesh interacting with colleagues from Pan India, it is again remarkable the variability. So in some
Yes.
states, even professors don't make enough. This is not, they are not getting what you have, put in this table for AIMS like institutes. So they cannot survive without private practice. Well, the salary is not good enough, not even at the level, I would say, of the assistant professor that you have written. So they need to supplement it with private practice.
Yes, yes.
Right. And the same feedback I got from, I just was casually talking to people that why you did not opt for a government. They said because we need to do private practice in the evening. So they find the best balance of being allowed to practice. For example, in my job, I cannot practice, but then I'm around this table, so I don't need more. But if I was earning 1 or 1.2, you cannot subsidy, that's not enough. So many of the states, they are not paying enough. So again,
Yes.
like I said, you need to be clear because then you would have no choice but to also supplement with private practice.
Yes.
See, in Gujarat state, practice is not allowed. So I had a working wife, so I sustained, but then off the record, people practice. So there are some options available. But then, of course, one salary is really difficult. If two salaries are there, then you can balance. Or in the evening of the record, many people practice. I never, of course, ventured into it.
Here comes the disclaimer, Namita, that's not true of Delhi. So we have a very healthy salary, so you can survive easily.
Yes, yes.
Just one point to make. See, what happens is when people join an institution, especially the private institutions, where they are given a small salary. In fact, I think Namita has shown in other institute 1.7. Believe me, in Karnataka, not many people, many colleges, they are offering 1.7 for a professor. It is less than the SR in central institutions. That's what offered. But the advantage, as was told, the practice is allowed. So what people do is, they work for a few years and at the same time, they build their practice. Once the practice is built, they quit the job. They get that kind of, some salary or some kind of support in the beginning. That's one type. But then I know many people who have had a roaring practice, but then they left their practice, continued in teaching job. That is also there. You have both the types. Then there is something unique system in many of the colleges. They have incentives. That is a performance incentives. I think that's mostly in deemed universities and some of the good private institutions. So based on the performance of the department, they pay an amount of money, which is divided among the faculties. That incentives based on your performance. So that is one thing. And then some of the institutions allow private practice in their own institutions in the evening times. So you don't have to establish your practice, go out and spend money or for the clinic rental. So they provide all the facilities. And then evenings, they allow you to practice. That is your pure private income. Maybe there is some share between the institutions. That is generally happens in the institution, those who have a corporate hospital also. So these are the few of the ways, in private colleges, how the people are managing.
Thank you, sir. Thank you, ma'am. So Yogesh sir, what about the financial support for academic activities, such as support to attend conference, incentives for publications, or resources for the funding for smaller projects?
So very good question, particularly to me, because our government is giving reasonably good salary plus vacation plus special casual leaves to attend conference, but not a single rupee for deputation or for upgrading knowledge like that. So most of the government, state government, I'm not talking about, no academic allowance. You have to pay. If you want to join American Academy, I pay and become member like that. So that is not there in most of the institute, particularly government institute or even private institute. But yes, the advantage of government was that reasonably good salary and pension benefit. We had old pension scheme, which is very good. Now it has changed, but old pension scheme is a very good life family pension scheme. So that these were the advantage. Reasonable salary, vacations, special casual leaves to go for exams, MCI inspection, whatever. We have enjoyed all those things in while I was in government. but
Thank
no
you, sir.
incentive like all this you have enumerated.
Anybody would like to add an inputs to this question?
Yes, so we get allowances for attending conferences. So that is great part, but then the allowance that we get for stay, that is somewhat measly, and then we can't afford to stay in, say, 4-star or 5-star accommodation that way. So that is one downside, but then we can attend 4 national conferences a year.
Okay.
Okay, and then there is no incentive for publication per se, but then publication arises from good research, and then the incentive of publication is being known to the peers, the colleagues. So that is an indirect incentive of publication, nothing direct, nothing monetary. There are small scale research funding, but then that is competitive, and the projects proposals are assessed by the medical education and research cell, and not that everyone who puts in a proposal gets funding for the small scale or initial research. Academic allowance, yes, it's there, and say for example, 1.5 lakhs per year, it's a good sum, and then we can become or we can use these academic allowances in becoming members of international societies or even national societies, and we also can somewhat cover the expenses for publications. So that's for us.
That's a fair sum, sir. It's a
Yeah, but Namit, I would like to put a disclaimer right here. You are talking to the absolute cream. So these kind of facilities are available only to PGI and AIMS, and it's true for all the AIMS that have opened up across the country.
okay.
So we are not as bad as Dr. Marfatia said. So I'd like to take the first one, support to attend conference. I think all of us would agree the biggest support to attend conference is getting the leave. That is the biggest thing. And all of us have heard colleagues who are practicing, kind of lamenting that they missed out on their practice for so many days. We don't have that to worry. We don't have any salary cuts. So we get leave, and it's like mentally you're totally free. You keep getting your salary without any cuts. The incentive for publication is already what Dipankar said, but it's also, your promotions. That is a very big incentive if you are still, along the line. And resources, and we have funding, and we have academic, and for us, we get 2 conferences in a year. So even that is a decent, reasonable kind of help that your institution provides. So it's again very variable, but remember, being able to go for a conference and not having to worry about your private practice is in itself a very big advantage.
But ma'am, of late now, the leave for most private colleges, it's because the NMC inspection, it's not very easy now to attend conferences.
True.
Dr. Manjunath is agreeing with that.
Yeah, two things here. One is the private colleges in general in South, I can tell there is no such support for academic activities. Not, I mean, maybe even if it is there, very meager. But now, where the deemed to be universities, generally, they give some kind of support. Attend conference, of course, we have special leave. I think that is there in most of the state colleges also, state-owned colleges and private colleges. But there is a limit. For someone like, me or Dr. Dipankar, where, you get a lot of invites as faculty, that is grossly insufficient. But then we have to choose. Incentive for publication, we have 2 types of incentives in deemed to be universities. I don't think they exist in state-owned colleges or in some of the private colleges. The academic incentive and research incentive. But that is not individual publications or things like that. At the end of the year, based on how well you perform, there is a point-based system. Based on that, it is given, but it's not huge. Then resource funding, small scale research, academic elements. Because I'm in a deemed to be university, again, I have what is called the intramural grants they give, up to 5 lakhs they give annually. That is intramural. Then I have a very strong support for extramural grant also to obtain ICMR, DBT. That is why at least we have three funded projects which are running extramural in my department. And I have at least 2 intramural projects. That is because we have PhD system also. So that is how the academic environment is maintained in deemed to be university, because we also take PhDs also. So that is one of the reasons. Whereas in what I also represent, Dr. Savita can chip in. She is in a pure private college. I think you will tell the real story now, because that is the one which caters a maximum number of jobs.
Yes. So there are special leaves, but because of NMC and inspection, it's always tough. There have been times when we have cancelled the last minute, come back from the conference because they thought there will be an inspection, but there was no inspection. And there's no incentive for publication or nothing. There's nothing. That's the for
Dr. Namita,
research.
so it's a time to wind up, because by 10 o'clock we have to it will move on to another
Okay.
platform. So GST issues. So almost 6 o'clock it is continuously
Can
running
go for
week.
another
Yes.
5 to 10 minutes. It should be okay.
Yes.
Yeah.
So this is the question: what to look for before joining a new medical college? Like, there's so many new medical colleges now that come up. NMC has granted permission. So Savita ma'am, like, you're one of when you joined Saptagiri, I think it was in a nascent stage. So with Manjunath sir too, both of you joined it when the department was in a nascent stage. So what are the advantages? Is there, if there is, and what are the something that you look for before joining? Now many youngsters may be looking to join.
So if it is a new college, when a college starts, they get something called a NOC. So your experience there before the NOC is not counted. So when you attend the interview or want to change jobs, that experience will not be counted. That is one thing. Second, if it's a new college, look who the management is. If you're going to get your salary on time, you don't know. So if there's a department already running, you could probably speak to the colleagues and see the feedback. That's an important thing. There are few places where they've joined and salaries have not been given for 3 months or 6 months, and it's given late. So that is one thing to be kept in mind. Advantage is you start the department, you can build the department like you want, and when you start a department, there is this attachment to the department and you work for it. So it's a nice feeling to start, but there's a lot of work. You're short staffed in the beginning. There's a lot of paperwork to be done. You're preparing for recognition of the department, of the college first, and then the department. Lot of inspections, uh, less pay, more work, more paperwork, unwanted work. You had to write dummy case sheets, and no interns to help out at that time also. Yeah. So
Yes,
basically,
ma'am.
a lot of work.
Sailing through it now, ma'am.
Very less academics then, because you're not teaching, you don't have PGs, you don't have interns to teach. So, but
Yeah.
yeah,
One thing
just
I'd
be
like to
postgraduates.
add, one thing to what Dr. Savita has very rightly pointed out. Please read your appointment letter very carefully. Most of us don't bother to do that because
Yes.
you don't want to be exploited.
Correct.
So that is something doctors are over trusting.
Yes. Yes.
Yeah, one point is very important. What Dr. Savita mentioned is new medical college. You have to be prepared for a lot of paperwork if you're joining, because you're going to face a lot. I have faced more than 50 inspections, and not all NMC inspectors are like Dr. Yogesh Marfatia. We had wonderful inspection. He had come as a PG inspector. He's very meticulous, and he treated like his colleagues. But that doesn't happen every time. So that's one thing which is really important to know. And also, this is my, I know bargain for the salary. All these new medical colleges, there is a bargain for the salary you require. But also, as Madam Deepika mentioned, that you should always read the terms and conditions very carefully also. That's it.
Is I think this is a big question. As there's shortage of time, we can probably skip it unless any of the panelists have something to share about this. Any challenge you faced in your medical college career that was that you had to overcome, so that will inspire the younger audience who did listening to us.
In government sector, we have to change the place very frequently from the city to periphery to somewhere area. So that is a great challenge. Once if you try to settle with your children, and suddenly they will shift somewhere else.
One
Yes.
more point
Or
is
several
If
couples
it
who
is
have
a
stayed
new medical
apart.
colleges, and they will endorse the work of the administrative work along with
Yes.
the department.
In
Correct.
state government having multiple colleges at every stage, you need some support to get posting at your favored city. This is very critical, and many people leave the service because of this unwanted transfer. You need some
Yes,
maneuvering. If you don't, you are not in a position to maneuver favorably, then you are gone out of this game.
One of the positive things I'd like to say, we don't want to end with negativity. So I will talk about a positive thing. So it was mentioned on Quora, I read somewhere that dermatologists are increasingly becoming principal and chief administrators in the because we don't have super specialization. So we become professors early. We are clinicians and yet we have some time. So think of the advantage of dermatology. So you have so many institutions now headed by dermatologists.
Yes.
So that is the beauty of our field.
Yes, ma'am. And I think for this question, the answer would be yes, because all of you have a lot of publication and niche areas where you've done extremely well. And again, prohibition to engage in private practice is depending on the institution and the state. Most private medical colleges here do allow.
But business venture and patents are allowed everywhere. You just have to keep your administration in the loop.
Okay,
so in fact, encourage patents. You just don't have to blindside them. You have to inform them about any possible commercial activity that you are undertaking.
No, it may be okay. So for us, it's patent is fine, but then all other activities where there are financial transactions apart from salary, I mean, it's very difficult to go through the paperwork. So anything monetary apart from salary is quite difficult.
For example, if you want to join somebody who's manufacturing a cosmeceutical, is that allowed?
No. So we are not even allowed to sit in the advisory board of any pharmaceutical company. So I mean, I think that makes the situation clear.
Yes.
Yeah. Can you? I just want to know. You want to start one hotel? Is it possible?
No.
It's absolutely nothing to do with pharmaceutical industry.
No.
Even that is not allowed. Only thing what you can do is, I think, stock market. If you want to have an additional earning.
No, so that is investment. But even for stock market, if you are in trading, then that is not possible. So if you are investing in mutual fund, that is fine.
And buying the stocks, I think. Yeah. If you are not supposed to do a trading also. Okay. So
And Dr. Deepankar, once any person will become a professor, he can enjoy to attend all the conferences, national and international, with all facilities. Is it right?
No, not all, but there is a cap.
Professor
right?
level.
So,
At professor level, they
for
can
all
go
levels. For all levels, for national conference, it's 4 per year.
International with
international,
business class, I think.
No.
For business, for professor, it is a business class.
For professors, it's a business class, yes. And all below that, it's economic class.
So again,
yes, they can enjoy in that way.
Namita, disclaimer. This is only for PGI names, so nobody should go in for anything.
Yeah, it is for PGI only, I'm asking. It is only for PGI.
Only Deepankar Day is getting it.
Yeah.
Yogesh, sir, the question like if does the institution encourage participation in academy or the association activities? Is it encouraged or is it discouraged that the time from the your workplace is given to this?
I entered into it. I was never resisted, but there was nothing like encouragement. By my own, I started the state branch, national level, and other activities. Never, any resistance or any opposition from management, but no encouragement as well. If you want to do, it's your motivation.
Yeah,
Any of the panelists want?
Ditto. I think everywhere, in a private institutions, it's the only thing. But only thing, when you are in good position in the association and all, then say, oh, then your inspection should be very easy. That's the only thing private institutions are interested in. Yeah.
No, so there is
All
no
inspectors, something like that. That's what
no resistance for us. Me, Anuradha, and Hitashi are here in the association work. And then the academic chairperson is from the department, and editor-elect of one of the journals is from the department. So full full encouragement for participation, but then it should not affect the working of the department. So whatever we do is additional to what we are supposed to do in the institute as for patient care training and research.
Again, I read somewhere in one of
President sir,
the
15 minutes break after this meeting. For next meeting, 15 minutes break for
No,
dinner.
I think it's almost over, I think.
No. For next meeting, there is a break for 15 minutes for
okay.
dinner.
Okay, fine.
So Namita, again, I'd like to reiterate, one of the biggest encouragement can be the leave that they give you. So we should never underestimate the importance of the leave that you get to be able to participate. Was 6 years in the academy, I was never denied leave. I could attend every conference, DermaCon, participate, and also it's like Dipankar said, it's additional to your work. But that kind of support is there. And they are very happy to have you do all this because it all goes in their annual report, and their annual report looks healthy. So that kind of passive support is there, because we had an inspection, and the inspector said dermatology department is the star. So that felt good for us, and the institute head feels very happy. And I have seen some private institutes where you've had people working in this. So, it draws attention to the institute. It gives them a glam factor. Like now, Dr. Manjunath Shenoy being where he is a glam factor for their institute, that he's the IADVL president and other credentials. So that is most managements, private institutes, they feel happy about that. So you'll actually have people coming to Dr. Manjunath saying that we want to join your department because they've heard about him. And that is a very big factor for the management.
Yes, ma'am. For inspection care, I think we covered this in one of the previous questions, that I think Manjunath sir and Savita ma'am should be like, how often have you had to change your plans, sir, and how frustrating, and how did you cope with it?
Yeah, I think fortunately for me, although I travel a lot, none of the inspections troubled me. Fortunately, I was very fortunate. It was not true with one of my colleagues. He had booked a semi-final match of Pakistan and India. Guess cancelling that the World Cup, which happened in Chandigarh, and then it went on winning. So sometimes it can be really disturbing for the private institutions when that inspection scare is there. And generally, it is felt that inspectors don't come on weekends. So that is, I don't know, but it is not true. We had inspections on Saturdays also. So that is why often they allow, because and the conferences generally occur in the weekends. So if it is a Saturday, Sunday, often they allow, but otherwise it is very difficult during inspection period. And inspections are almost around the year. You have either UG or PG or recognition inspection or increment of the seat, some more other things which keep happening. Yeah.
Savita ma'am?
Yes, many times I've had to change plans. I've gone back from conference also because the inspection scare, and then the inspection did happen. My colleagues have cancelled their international trips and cancelled the tickets because they were not granted leave. We were actually not granted leave for almost 2 years. No CLs also. When the college started initially, for 2 years we did not avail any CL also. So we worked on all days. We had to go in the morning, mark attendance, and then we could go back after 11 or 11:30. It was like that. Quite frustrating it was then. Now it's okay.
Just leave policy, I think we've discussed mostly. This is probably the central institutes do offer a summer vacation and 10 days winter vacation. I think Delhi University also offers that, if I'm right, Deepika ma'am?
No, we get more than this. I don't want to say that how much more, but significantly more than what is projected.
Okay. So
Yeah. I think vacation is the feature of only central institutions. There is no other institution, to the best of my knowledge, but there is what is called earned leave. We have EL.
yes.
EL facility that is usually for 1 month. Maybe it differs, but we have compensatory leaves. That is because we work on the government holidays. That's why we get compensatory. Then we have special leaves for attending the conference. That's it. That's a thing. So we don't have anything called vacation, but we have earned leave. Earned leave is something like vacation only. Basically, you can take it. But since I was mentioning about incentives, you lose the incentives. Salary will be there. Yeah.
So most places do not let people encash the earned leaves. Not every college allows for it
Many
to be
colleges,
encashed.
they don't, although it's called earned leave, they don't, it
Yes,
doesn't earn
you
them.
cannot. You earn the leave, so that. So also they're reducing the number now. They're going more after the corporate side. So at least the college where I work, they've reduced it to 18, sir, from 30.
Right.
That's their policy.
So we have 30 ELs, but we cannot avail more than 7 days at a time.
At a time, yes. So our college has reduced it to 18 in total. So they said that's a new corporate policy, even in the IT sector. So although the IT sector does have Saturdays off, which is not taken into consideration.
Yeah, we have, as you said, CLs are there, compensatory leaves are there. That makes it fairly healthy looking. Yeah, I think that is there in private colleges also and in government institutions. But only the question is, can you avail them? Because
Yes.
when you have an inspection scare, that doesn't matter.
Yes.
That's the only thing.
The retirement policy, the central institutes, I think it's 60, and NMC has allowed up to 70 now. So, any inputs for this?
They Pankaj have 65.
Yeah, we have 62 Gujarat government, 62 years.
Oh.
5 for us, central government.
Yeah, in private colleges, it is 60 generally. Some institutions, give what is called superannuation that is based on, requirement.
Okay.
Generally, dermatology is not among them because dermatology is usually a single unit. In medicine and all, where there are 6 units, requirement of professors are more. They require more number of faculties, professors. Otherwise, I'm sure you all must be knowing this dermatology has become now top heavy. You have an opportunity in SR job you may get, but not a professor job.
Yes. So, does being in a medical college add to private practice? Manjunath sir, Bhumesh sir, and Savita ma'am, does it add any value to the private practice to help build it? This is for someone who's planning of being in medical college for a few years and finally transitioning to private practice. Other than the monetary thing, does it add to any other values?
Get a professor tag, your professor, doctor, so and so. Other than that, I don't think so.
I don't know being without medical college. In my all 26 years, I've always been with the medical college and practicing both. I think it does add because people do recognize to an extent, being a professor, number one. Number two, what I have noticed, especially in places like Tamil Nadu and Kerala, they become very famous. The medical college faculties, they become very famous. And once they retire and start their practice, they get a roaring practice. That means there is a value for being a professor in college. And number three, I think you get, balance between the academics and practice becomes easier. But time is a constraint always.
Yes, yes. And yeah, work-life balance, we did speak about it. I think where colleges where there are more leaves, it does help in having better work-life balance. But the newer private colleges, when leaves are an issue, inspection is an issue, I'm not sure. Savita ma'am, what do you have to say about this?
If you're doing just college and not doing private practice, then yes, there's enough leisure time even if you're in private medical college. But if you're in private medical college with evening practice, then there's a lot of constraints.
Even with only a medical college, when there are leaves are an issue, does it impact your family life because of the rigidity, that the fact that you can't?
I'm comparing
private practice has some flexibility with regard to the timings.
No, I am comparing with private medical college with and without practice. So, just medical college without practice is definitely better. We have more time. At least you get Sundays, weekends off.
And I think all the other panelists do have a better work-life balance. I think Deepika ma'am and Dipankar Dey sir, and the leaves policy seems to be much better there than the South colleges.
Right. So the
And
government debt
unless
is
you
much more
unless
streamlined.
your academy chair or convener, right? So
So I will end it with the on a lighter note with the question that's if not for this career, is there anything else you would have chosen? Yogesh sir, I'd just like to ask this to everybody.
Oh,
Is there
yeah.
anything else you can imagine yourself as?
I don't think so. After being there in 40 plus years, I mean, I don't think so. I think this is, and I consider this as the noblest of noble profession. Teaching, particularly in medicine, both combination, noblest of noble profession.
Manjunath sir?
I'd have been owner of a medical college.
I think you can still do so.
Because I can trouble everyone over here. Just a lighter note, but I think no, medical was always pushed in my brain by my parents, so I couldn't think of anything else. I think my parents, although I'm also actually a first doctor in the family, I'm a medical doctor in my family, but somehow parents had got a huge passion to make one of their child a medical doctor. So I happened to be that person. So
Bhumesh sir? Sir is gone for dinner. Deepika ma'am?
This is an interesting question. I don't want to elaborate too much. It is something that the only thing I can say, I really enjoyed dermatology. I really enjoyed dermatology and I still do. And that is the biggest, fun of taking a career that you can enjoy for so many years. You see the burnout in other careers and you realize how lucky you are that you still are interested, you're still passionate about your subject. And the other thing that is none of the others are saying, so I want to say it is that it allows us to be flexible. So if Dr. Manjunath wants to become a singer, he can take it up, being a dermatologist. So it can allow you to diversify. That is the fun of dermatology. We are not, our nose is not, to the grind. So we have some time, at least us, me and Dipankar have the time to think of some additional add-ons. So I think I love what we have because we are able to enjoy it till date after so many years.
Yes, ma'am. Dipankar sir?
No, I'm perfectly all right what I'm doing and what I did over last several years. So Dr. Manjunath sir was quite correct. I mean, that is in reference to the previous question. So work-life balance is perfect as of today. I mean, if I want to start at 8 and end at 5, then it's up to me. But then being in research, so it takes and publishing and also editing and all as of today. So it takes a lot of time. So it's not only being in academy, but also in other work that we do. It takes a lot of time. So, but then it's all to our own volition. I mean, nobody forces us to do the research after working hours.
Savita ma'am, Dr. Anuradha?
I think I'll want to start as faculty in PGI now.
Agreed.
What about Bangalore?
Savita,
I'm
usefulness is not too bad.
yeah, Dr. Bhumesh, can you allow me to share a screen? I just want just to ditto what Dr. Deepika just told. You know, most surveys mention that, see, I think I'm
Done.
sure. So this is one of the incentives. See, most
She has to stop. Namita, you stop sharing.
Stop.
Yeah, physicians who are happy at work, see, dermatology, in most of the year surveys, dermatologists are the happiest, even more than psychiatrists, imagine. So, yeah.
No surprises there, Dr. Manjunath. No
Yes, so
surprises.
this is a wonderful thing which I have been seeing it for the last 20 years, almost 15 years at least, since when I'm watching that. So I think we have better work balance than other colleagues like surgeons or physicians. That is no
Main
doubt.
gynecologists, once if they get gynecology, they will have BP as well as sugar. So these two are mandatory for them, even for surgeons. So that's why we dermatologists so fortunate. The only duties will be exempted.
Yes.
To do one duty, how much pressure in the duty we cannot imagine, especially for gynecology. They have to take care of two lives.
Yes.
Yeah. Lot of stress. I agree. Compared to them, we are much better. And earning is also good off late, both for the faculties because of the better salaries compared to what it used to be 20 years ago. And also in the private practice, no, I don't think I need to talk much about it. It's become definitely one of the shortest field because of that. So.
Again, Dr. Namita, one of the things I read on some of the blogs. So there was a question, how is dermatology and compared to other specialties? So there were a lot of, debatable kind of comments, they were debating amongst each other. So one of the things about dermatology was you don't need money in practice, but now you have so much stress with other specialties competing. So getting an academic job gives you stability, peace of mind, and you are happily just, doing your job. So it cuts out all that stress. So I don't know, you can debate it either ways. But people are talking now, in social platforms. So that's a good point. So it's very relevant that you brought up this series at this time.
Yeah. The final suggestion to younger dermatologists, please practice with a learning attitude, not earning attitude. So if you practice with a learning attitude, earning follows. So whatever the earn within 5 years, whatever you get, that is more than enough. Beyond that, so only counting the papers. So practice the learning attitude, earning follows. But if you practice earning, you won't get learning. So in your life, the satisfaction only occurs to learning.
Thank all the panelists for this very lively discussion. So many points, so many inspiring.
Joining in 5 minutes. It's over.
There's one question from the audience for where to submit a research
Going
protocol
on.
for ethical.
The president also here both.
One question from the audience: where to submit a research protocol for ethical clearance as a private practitioner interested in academics? Bhavani Singh sir, if you're here.
Yeah, I'm very much here. So you can put your research proposal in the nearest
President sir, I
institutional
think we have to
ethical
close. The
committee,
EC are
in the
they are
nearest
also waiting.
private medical college, or for some
EC,
corporate
all EC are
hospitals.
waiting. Namita, please close now. All EC are waiting.
So we can thank all the so Bhavani sir, the answer was that
Yeah, even if you do not work in an institute, as an outsider, you can put up your research protocol or research proposal in the nearest institutional ethical committee, be it in a medical college or some corporate hospitals also have their own, like Apollo, they have their own institutional ethical committee where you can propose your research proposal.
And then there are private ethics committees also.
Yes, sir.
They're chargeable. They're chargeable. You have to
One
pay
more
some
way is,
money.
collaborate with one of the institutional faculty. That's another way of,
Some are free, some they levy a charge.
Yeah.
I invite Dr. Soumya to present the vote of thanks.
Thank you, everyone. Thank you to all the faculty for joining us. Thank you to IIDVL EC, Dr. Manjunath sir, President IIDVL, Dr. Bhumesh sir, Honorary Secretary General, IIDVL Dermatology Educational Task Force, all the members, Chairperson Dr. Deepika Pandey ma'am, Convener Dr. Dipankar De sir, and Dr. Namita, Chairperson, and all the members of our USL who have been so supportive for us to start this new series of Career Genie. I hope everybody enjoyed as much as we enjoyed, thinking about this and bringing it forward to all of you.
Yeah. We all enjoy. So next time, time we have to maintain. That's because it disturbs other activities. So that's
I think we
humble
will
request.
Yeah, no, I think we will create different links. Don't worry. But only thing is, yes, as you said,
But we have to maintain the time. So if you won't maintain the time, the interest will go. That's one suggestion, that take it positively.
Yes.
Yeah.
Good night, everyone. Good night, everyone.
Yeah.
Okay, bye. Good night.
Thank you.
It's the same link. We are continuing here.
Okay.
Yeah, I think so. Bhumesh and we'll stay back.